Yeah, I've been here 6 hours, mate. I'm in absolute agony, I really am.
Okay.
Can I have something to stop this pain, please?
Right, just bear with me and I'll speak to you shortly. How are you?
I can't even put my...
Sorry. Some days are like that.
I can't even put the back of my head on here because my neck hurts so much.
Okay.
Hello, sir.
Hello there.
Imran Hassan. I'm in charge
I've been waiting for you for 6 hours, mate.
Oh, well, we've got...
I know you're busy, but I've had no pain relief or nothing.
Apologies. So I'm in charge tonight of the night shift, and this is Dr. Godwin.
I'm really glad. That's all right, I'm only filming myself. I have to record everything, mate, honestly.
No worries.
Nothing against you two.
No worries.
I'm not filming you. It's for I have to document all my own treatment, yeah?
That's fine.
I don't know what you... Oh, God. I've got some x-rays here if you want to have a look.
No. Bear with me for a second. My name is Dr. Godwin. I'm a psychiatrist.
Right.
Right. So, with regards to your pain,
Yeah.
I'll not, in a sense, I'll not be the person.
I know.
Yeah.
I know. I just want some pain relief. I just want to rest from this pain. It's ridiculous the amount of pain I'm in. It really is. You know.
So.
What time did you come in, sir?
4 o'clock.
4 o'clock, because with regards to psych, we've only had a referral at 7:45. 7:45.
Are you a psychiatrist as well?
I'm part of Psych Liaison, yeah.
So you're neither of you are doctors?
He's a doctor.
Oh, you're a doctor?
Yeah.
Oh, you're the psychiatrist. I thought you were a psychiatrist.
No, he's a psychiatric doctor.
What for? What have you come for then?
Well,
do you know what's wrong with me? Have you got any idea why I'm in here?
You, as far as we've been told, that you're suffering from chronic pain.
Yeah.
And you're feeling low in mood.
Well, if you knew what injuries I've got, so would you.
Yeah.
Doesn't need a psychiatrist, I'd need treatment.
Yeah.
Okay.
You know, pain relief would be a good start.
That's
6 hours I've been waiting.
Stanley, can I just cross-check a few demographics with you?
Yeah, go on.
What's your date of birth?
18/11/54.
Right. Okay.
I can't believe they've sent psychiatrists. They've tried this one on me before.
Right. You need
I'm sure you're very nice people.
Yeah, you need to know who.
No disrespect or nothing, lads, you know.
Stanley,
I can hardly move my head.
Sorry, I'm sorry. Let me come round.
Yeah,
This way.
that'd be helpful.
That would be helpful. Have you been seen recently in Hillingdon?
I haven't been in Hillingdon for about years. I can't remember. At least 10 years.
For about 10 years.
Something like that.
Have you seen? When was the last time you saw a psychiatrist?
So 2010 I saw one when I was in West Middlesex Hospital,
In West.
where they threw me out. They told the police that I had nothing wrong with me,
Okay.
other than a chronic mental disorder. But then afterwards I went to Poland, and I had a full body scan, and I'd like to show you. Hang on a minute.
You know something? It may not be relevant now.
It will be, because it'll help you. What you'll read. Seriously, you need to see this.
You know what, Stanley?
Hang on, look, check that out.
I'll say, hold.
Look,
Yeah.
does that look like a chronic mental problem? Yeah, hang on a minute. My knee, no cartilage in my knee. My back. I've got osteoporosis.
You'll be showing this to the medic when he comes to see you. Okay.
Right.
So.
Oh, he's coming as well, is he?
Yeah.
Yes.
Will it be today or tomorrow or next week? because I've been here 6 hours, you know what I mean?
I know it's not.
I need some pain relief, really badly.
Listen, bear with me. Let's try and get to the bottom of this as quickly as we can, okay? So,
Doctor in the x-rays, look, to cover up what they've done to me. My arm is not connected to my body anymore, right? So that's why my neck is collapsing. I've got 4 collapsed vertebrae in my neck as a result of that, because the weight of my arm is no longer connected to my body, right? So the weight of my arm is being carried by my neck, not my shoulder, which is now, as a direct result, I've got 4 collapsed vertebrae in my neck, right? This is the truth. This is the facts, right? Last time I saw a psychiatrist, they told a pack of lies. So forgive me if I don't respect your craft,
okay.
Right? I've studied psychiatry myself. I actually made a video about you people.
Okay.
You know, I'm a filmmaker.
Okay.
I'm not an idiot, right? And I'm not. I've got clinical depression, which is anyone would have with these injuries, without getting treatment. Yeah.
So can I just, you know,
Sorry.
know you might be.
I just want you to be clear where we stand with this, right?
So are you on medication, sir?
No, painkillers they've been giving me, they don't touch it. Don't waste of time. All they're doing is make me constipated.
So what pain relief are you having?
I don't get any pain relief. I've been given loads of tablets, but there's no pain relief.
Do you know what's the...
Tramadols.
Tramadol is a very strong...
I know they are. And that just shows to show you how much pain I'm in. I had 10 tramadols. Like the other day, I took 10 tramadols in one go.
You've just said to me that you're not on any pain relief at all.
No, I'm on tablets, but I don't get pain relief from them.
Okay.
It's 2 different questions, isn't it?
No, I think we're on separate.
If I'm on medication, yes.
Right. What I mean by pain relief is tablets.
Yeah, because when you say relief, that means that suggests pain killing.
Okay, that's fine. So are you on any painkillers?
Yes.
Okay. What painkillers are you?
Tramadols.
Yes.
Hang on. Duloxetine, which was kind of an experiment because a lot of my troubles, trapped nerves, my fingers, they're like electrified. It's literally like I've got my fingers stuck in an electric socket, right? I can't grip nothing. I'm in absolute agony with it.
Can I just see this hand, if you don't mind?
Yeah, that's Gibriton's contracture. I've got it on both hands. That's where they put the nails through on the cross.
That's not what they call it.
That's a joke.
Yeah, okay.
Yeah, that's another. No, I'm waiting for that. I'm waiting to have treatment for this.
Okay. Right.
They've got to operate on that.
Okay.
So, but I've been waiting and nothing's happening. I'm getting my neck is so bad now I can no longer hold my own head up. Right, it's becoming quite serious now.
Right.
I've not been treated for so long.
Okay.
So I've been denied it.
So primarily today you've come because of your chronic.
I've reached the point where I've been in so much pain.
Okay.
I've not slept for 4 days now.
Right. Okay.
And it's got beyond a joke. If it goes much further, I do feel like I'm going to just cut my throat. That's where it's driving me to, because I'm not getting the treatment.
Right.
Now get me the treatment, and I won't feel that way. Simple.
Okay.
Yeah. That's it.
How long have you been?
Simple.
How long have you been on duloxetine?
Only a few months now. More of it was trying things out. I've had 2 spine operations, right, and following that I was put on morphine. Okay, in 1990. Morphine sulfate, MST, yeah? Slow release. 1990, I was on 10 milligrams every 12 hours. By 1999, I was on 300 milligrams, right? And I was still in pain, so I stopped taking it altogether.
Mr. Richardson, you need to answer my questions.
Sorry.
Who is prescribing your duloxetine?
My GP.
Okay.
But they ain't working.
That's not working.
No. It was more of an experiment to try it out, because I was trying to explain to you. I told my doctor I don't really want to do morphine, because I've been there, done that, didn't work. So I don't want to go there. So rather than put me on morphine again, he's trying different things out, but nothing's working. I'm just in a lot of pain, mate.
Okay.
And I just want treatment. My shoulder, look at it, needs fixing.
Right.
How did you come here today, sir?
Ambulance.
Ambulance.
My doctor called the ambulance.
From your home residence?
Yeah. I had to go to the doctor's this morning. She sent me home and then called the ambulance for me to come and pick me up to bring me here, in the hope that I could get a few days pain relief to break this cycle of pain I'm in.
But your residence is in Hillingdon. They didn't take you to Hillingdon?
No, well, last time I was in Hillingdon, they threw me out. Right? Because I found out that they doctored my x-rays to hide cover up what they've done to me. See this injury to my shoulder, the surgeon who did it has been done multiple times for malpractice. Right? He's famous. I'm just one of his victims, If
it has been done several times for malpractice, I'm surprised that he.
Well, look, you can check it. Yeah, tell me about it. You can Google it. Google. Do me a favour, right? Google Nikos Rhesis, right? You'll see in there big newspaper clippings, right? You'll also see the film that I put on there about him, because I made an hour-long documentary about that man, right? He's butchering people. One case alone, he was in court. One woman lost a leg because of him. He'd operated on a guy's ankle, but he shouldn't have done, but he'd lied about the x-rays. 15 other charges were taken into account, and they let him off with a warning. This man is still practicing. I found another one of his victims only last week on the internet, because I check him up every now and again to see what he's up to. And I found another victim that he's crippled. So yeah, that's the answer.
Okay, that's.
Excuse me, but I'm in so much pain here, and it's pretty sort of annoying.
I would leave you now, and the medics would.
No disrespect.
Yeah,
I
think this is a medical situation, so we're going to advise the medics that you don't need our input.
Thank you.
Yeah, you need the medics.
I knew you'd say that anyway. I've been told this before loads of times as well. Because they tried to say that I was mental, so I even booked a psychiatrist to come and assess me at my home. I did it myself, and he said the same thing. So it's only certain doctors who want to make it look like I'm mental, to cover up this stuff.
Sure.
This is why I carry this about with me now, so I can explain it to people.
Sure. No problem.
You know?
We'll get the medical team to come and speak to you.
Thank you.
Thank you. Have a nice evening, sir.
Can you ask them to give me something a bit pain, something to keep my pain?
Of course,
I'm
I'll
so
pass
much. My neck is seizing up.
Sure. No
Yeah.
problem, sir. I'll get the message.
Thank you.
Thank you.
Cheers, mate.
I can tell you what I can do to help, but I can't.
Yeah, you want to drug me up? You want to drug me up? Make the pharmaceuticals richer. That's all you're doing.
Provide pain relief.
But it's not happening. There's nothing to. The only way you're going to get my pain relief is to lift my shoulder back up where it belongs and stop my shoulder.
Okay, and I've done that. We've done the referral to.
I know. Hang on a minute. It's been 8 months now. It's getting on for a year now since I joined you, and I've had nothing so far. Nothing. So far, I've had an injection in my knee. And that's it. Full stop.
We have sent you to the specialist that you've asked to be sent to.
No, it's not about whether you. Yeah, they took 7 months,
Yeah.
and all I'm getting is denials, and nobody
Okay,
wants to go near me, doctor. It's ridiculous.
Mr. Richardson, do you want me to give you some advice regarding your pain relief? Because that's why I've phoned.
Yeah, but I know, but we've been doing this for 7 months, doctor. Why are you still trying to offer me advice when it should have all been done 7 months ago?
It can't
Seriously,
be done so
I'm in agony.
Well, it's not quickly. I know it's not quickly.
No, it's not quickly. It's not being done at all. Because I was referred to Stanmore Hospital. I've been denied my treatment, my corrective surgery, purely for saying, under my breath saying I see my solicitor 9 years ago. Now that's not right, is
That's
it?
not something that we can alter.
Right.
I want you to
It also states, hang on a minute, it also states, hang on a minute,
Okay, Mr.
hang on, just please, doctor, I just want to read something else. Hang on a minute, doctor, please, listen to me. Also want to add to this, that this letter from the hospital states that I went in there requesting an injection and a scan. At no point did I ask anyone for a scan. This is a blatant attack on me, a blatant lie, right? It's nothing, but it's what's been going on all these years. I thought things were going to start getting better once I started seeing your practice, but they're not, are they? Nothing's changed, and no one's doing anything about it. You're sitting by, idly watching this happening to me. No one is doing anything to stop it. So why doesn't somebody? Why?
Carry on this because
Well, I am, because I have to, doctor.
If you want to talk about pain relief, then
I'm stuck in agony here.
I can't go over this, Mr. Richardson.
So what
I can't
happened?
keep on going over this.
What pain? What do you mean keep going over this? I'm living it, doctor. I'm living it day by day. Each day that I go through like this is torture. Doctor,
Yeah, I can't.
why am I being tortured? Physically and mentally. What have I done?
I'm not, right, okay, let's stop for a second, okay? Last night you were in a lot of pain, you're in burning
Not just
pain in
last
your
night,
hand.
it's every night, doctor. It's not just last
Yeah,
night.
okay, every night. So what I think we should do is, whilst you're waiting for the next consultation, is to try and get on top of your pain relief. I think the next best step is going to be just adding in the pregabalin, because that's a nerve-related pain killer.
Yeah, and I've got to wait another week, and I've got to wait another week for, and I've got to wait a week for them to kick in.
Yes.
Well, I'm not prepared to spend another week in this pain.
Okay.
And a doctor, and I must say, I have been told that it was you who called the hospital to tell them that I'm not in there for medical reasons. I was told this.
Okay, well now you're accusing me of...
No, I'm not. I'm just telling. No, I'm not accusing you, doctor. Don't twist my words, please.
You've just been told.
No, I've been told. Yeah, that's not me accusing you. That's somebody telling me. I'm passing on. I'm just explaining to you what I was told at the hospital, and I was told.
Right, I'm going to end the phone call now because that is your...
So you're accusing me of accusing you of something. Well, all I'm doing is passing on what I was told.
You just asked me whether I had done that. I told you I hadn't.
But why would they tell me you had?
I'm not having this conversation.
Why would they tell me you had, though, doctor?
I'm not having this conversation anymore.
So is that more important than my suffering?
I'm not having this conversation.
Why would they tell me you had, though, doctor?
I'm not having this conversation anymore.
So is that more important than my suffering?
I'm not having this conversation.
Why would they tell me you had, though, doctor?
I'm not having this conversation anymore.
So is that more important than my suffering? Now, trying to get back to see this surgeon who did this to me, I've come across nothing but corruption. I've had a character assassination put on me. I've been branded as a known morphine addict and not medically classed as medically genuine. Now the morphine addict stuff is from spinal surgery that I had back in the 80s. I stopped taking the medication in 1999, January. In 2001, 3 years later, it was written in my notes that I'm a known morphine addict, not classed as medically genuine. This is used in all my referrals. Basically, I've been victimised. I want to show you something. Back in 2010, when I was in a terrible state, my rib, 6 months after I broke my rib, and my neck had seized up. So I got myself admitted into the hospital, to the accident and emergency. Told them I'd fallen down the stairs. Well, this wasn't the case. This was the state I was in. But to convince these people to get to X-ray me, that's why I had to tell them. Why, after they'd done a full upper body scan, X-rays, I was told I'm going for a scan. I asked the nurse, why am I going for this scan? What's the problem? But she told me that my liver might be getting damaged from the broken rib, and they feared that my neck could be fractured. It's not, it's collapsing because of the weight of my arm. Anyway, I'd like you to take a look at some of this footage and the audio. The first part is the X-ray department at the West Middlesex Hospital, just prior to me going for my scans. Here's what she said.
No, we need to get a CT scan of the neck.
Right.
Because you're not quite sure what's happened from the point of view of events, we need to also get a CT, so we're getting a CT scan of the head, the neck, and of the tummy, because we're worried about any sort of injuries in that liver, because you're so tender out here. I'm not very pressed, I'm just putting my hand there, which is why we need to check that.
Okay, well.
Okay? We'll need to get x-rays of the thoracic spine and the lumbar spine. You did quite a significant injury. So,
Have we done that yet?
no, we haven't done that yet.
Oh, I thought we did.
No, we need to get the CT done first, and then we'll, because these are the more worrying signs.
So what X-rays have you done so far?
We've done the neck, the chest, and the pelvis.
What do they show?
The neck is abnormal. I'm worried that you've got a fracture there. Okay, it's very suggestive of fractures. The chest x-ray looks okay, but this, what we call the diaphragm here, has moved up, which can sometimes be an indication of injury to the liver. So that's why
I was admitted onto the ward for 4 days before I could see a consultant. When he came along to see me, he just said to me, "There's nothing we can do for your shoulder," and I asked him why. He said, "Because there's nothing to operate on." What do you mean by that? Because I thought I just had a ruptured clavicle. I just thought it would become disconnected. I didn't know this. He said, "Because it's been excised." He said, "There's nothing to operate on. And if you want it fixed, I've got to go back to the guy who did it." They also confirmed that I had a broken rib, but they didn't tell me the extent of it. 4 days later, shortly after that, just the consultant left, the police were called to throw me out. I hadn't done anything wrong, other than refuse to leave because I was desperate for the surgery. And the police told me that they were removing me because they'd been told that I've got a chronic mental disorder. Two of the police officers told me this. Now, and I'd like you to just leave me alone because I'm a very sick man and I'm in urgent need of surgery, which I'm being denied by doctors, right, who are falsifying my notes.
Falsifying your notes?
Yes.
No, what they have also told us is that you have some sort of chronic mental disorder.
It's 10 to 9 now, so it's been an hour and a half since she said I was going to get pain relief.
I know it's a senior review. The senior doctor has to review all the medical patients.
So I could be another good few hours before I see any pain relief. It's no good, is it? I can't lie you I'm not going to lie you any longer.
I can't give you anything.
Can you have a word with someone though? Because I'm getting really...
They are
really
reviewing patients. They are reviewing patients. They are aware that they have to come and review you. Stanley?
Yes.
What painkillers do you normally take?
You're not going to give me tablets, are you? Because I won't accept them. I'm not coming here to take tablets. Is that what you're offering me?
I'm just asking.
I'll take tramadols, but they don't work. Duloxetine and codeine, but none of them
So
work.
we can try with paracetamol IV.
What did I have? What was that I had earlier?
Paracetamol.
Well, it didn't work.
We can't give you
You
more.
can't give me nothing more?
No.
I don't care what you give me. I want something that's going to be effective. That's the reason I'm in here, for pain, get some pain relief. Because the tablets don't work.
Okay.
So you're telling me I can't have any pain relief now? We know that I don't need a psychiatrist. We've established that, haven't we, right? Now, I've been here 8.5 hours, right? And I've had no pain relief, and I've not even seen the doctor.
You have seen a doctor.
No, I haven't.
You have seen a doctor.
When?
The lady came to see you. Doctor.
I've been told that I'm waiting to see a doctor.
No, she was the doctor.
No, she was a nurse. I'm recording everything. I have to.
Record.
I'm not recording you. I'm recording me. But everything that's happening is being recorded and will be made public.
Problem. Yeah.
8 hours, and I've been ignored. 8 hours. I haven't seen a doctor at all. I saw a nurse. Yeah, a junior nurse. I have not seen a doctor. No, I haven't. I have not seen a doctor.
Dr. Merrifield.
When? What time did I see him then? Because I haven't. I have not seen Dr. Merrifield. That is not true, nurse. Now, if you're trying to tell me I've seen a doctor when I haven't, it's getting worse. Now they're saying I've seen the doctor. That's her there. Nurse.
I'm going to move you to the ward.
I know, but I'm a bit confused now. When you say I've seen a doctor, when did I see a doctor?
When I was here.
Was it a man or a woman?
A lady. On normal clothes.
In normal clothes?
Yeah.
No, I haven't seen a doctor. No doctor spoke to me yet.
Yeah.
No, they have. Only half an hour.
That's fine.
No, hang on. Only half an hour ago, you told me that we're still waiting for the doctor to come up. So when did I see him?
I've seen you, doctor.
Huh?
I said.
No, I have not seen a doctor.
Okay.
I've seen two psychiatrists.
We're gonna move you up to the ward.
When?
Okay.
What, now? Oh.
Yeah.
And would I get some pain relief up there?
Yeah, you've got pain relief prescribed. Okay.
What? That stuff what I had earlier?
Yeah.
Well, you know that doesn't work. I've told her. I've already made that clear. I've still not seen a doctor yet. I haven't even seen a doctor yet.
You haven't seen a doctor?
No. I've had no pain relief.
We're going up to the ward.
I've not seen a doctor yet though. Aren't I supposed to see a doctor first?
We need to move on.
Yeah, but aren't I supposed to see a doctor?
Yeah, let's.
Am I? Yes or no?
Yeah, you will see a doctor. Consult.
So I haven't seen one yet then, have I?
You have seen a doctor.
No, I haven't.
Okay, I'm not going to have this conversation.
Please don't lie to me, nurse.
We're going up.
Please don't lie. I've not seen a doctor, mate.
Go up to the ward. Okay.
Yeah, no, but aren't I supposed to see a doctor first?
You have seen a doctor.
No, I haven't. I have not seen a doctor. I've got evidence. I've got it all on video, so I know I haven't seen a doctor.
You have seen a doctor. We're just waiting for a senior review.
I've not had any pain management or nothing. I've come in here for pain relief. I've been here 9 hours and I had nothing. A paracetamol.
We're going up to the ward, okay?
You're having a laugh, aren't you?
We're going up to the ward.
Hello there.
Are you on these?
Yep, sadly. No, yes.
My name's David Adibwig. I'm the consultant at
Thank you.
How are you doing?
Well, I'll just show you a couple of these. It might explain everything. I say, repeating myself.
Okay.
Alright, that's my knee.
Yeah?
My neck. Hang on a minute. I've just got hang on a sec. Alright, here we go. Right, there's my shoulder. What's left of it. That was left over from a rupturated clavicle. Right, I've had half of it amputated. All the ligaments were removed, including the AC joint. My supraspinatus tendon has been scraped off my humeral head. Right, during a routine clavicle repair this was. Right, the surgeon who did it has been done for malpractice quite a few times since then. As a result, direct result of this, I've now got 4 collapsed vertebrae in my neck. I'll show you now. Hang on, there's my neck. That was taken 7 years ago.
Right.
Alright, 4 collapsed vertebrae. Do we agree with that? Can you see that?
Yeah.
So 7 years later, I'm now pretty much FUCK'd, right?
Why have you got a hard collar?
Because that's the only way I can get around. I can't hold my own head up anymore. That was given to me in hospital, in West Middlesex Hospital in 2009, just prior to me being kicked out by the police because they were told there was nothing wrong with me other than a chronic mental disorder. Right? This is what they took.
If you use a hard collar, then you're obviously all your neck muscles will get completely weak.
Yeah, I don't wear it all the time. It's just like intermittent.
You shouldn't be wearing it at all, ever.
I can't move otherwise. It's the only way I can get out. I couldn't go to
It's not
my
going to help anything. It's not.
Well, I had to go to my
anything.
GP yesterday, and I couldn't get there without it.
Just breathe in and out, fine.
You're the first doctor I've seen since I've been here.
And in your notes, it was saying that you're under the pain clinic, or you're wasting.
No, I'm under St Mary's Hospital under 4 surgeons, one for my knee, one for my spine. I've got arachnoiditis. Oh, yeah, you need to see this as well. Right, a mass fusion, 85. There's the fusion, not fused, no sign of a fusion at all, just a piece of bone wedged in between my vertebrae. L45, completely dehydrated and cracked. Right. Arachnoiditis to boot, because I've had 9 epidurals. All went wrong. One gave me a spine infection, one nearly killed me. Right. At the moment, I'm lying here now, it feels like I've got a knife stuck in my shoulder.
Right.
Right. It feels like I've got a red hot needle going from my kneecap.
Okay.
And my back.
I understand all you're saying, but none of this is an acute.
I was sent in here for pain relief. My GP sent me in here.
There's no point in doing that.
Well, I'm just telling you what happened. My
I
GP called the ambulance yesterday because I was in such a bad state. She said I need some. I've been taking tramadol for 7 months now, and then they don't work anymore. I'm completely immune to it.
There's no role for what your GP's done. You need to be seen. Go back and see the pain team.
I know, but I had a full spine scan done 3 months ago, and I'm still waiting for the results.
But then the GP should be chasing that up. We don't even have a back surgery.
My
here.
GP has got no power left because nobody.
Okay, listen.
She writes letters, but nothing happens.
We don't have anything to offer you.
Well, I know you don't.
So
I'll
go home
Well, how do I get home then?
in a cab.
You are having a laugh, aren't you?
No, I'm not.
Well, how am I going to get in a cab then? Because I can't even sit up.
Pardon?
I can't even sit up. How do I get in a cab then?
You can't sit up.
No. What do you think I'm lying here?
How did
Do
you
you
get
think
to
I want to be in
How
here?
did you get to the GP?
With that on?
Well, put it on and get in the cab then.
And a lot of tramadol, but at the moment I've got no pain relief.
Why have you got no pain relief?
Because nobody will give me any. I've been here 24 hours now and no pain relief.
Relief.
Right, okay, it's alright, it's all recorded. Look at them all laughing out there. They'll think it's hilarious. Look, they're laughing. I think it's fucking hilarious. So that's the doctor having a laugh.
This is it, so.
Refusing to leave.
No, he's not refusing to leave. He's unable to leave because he hasn't got an ambulance yet. So stop lying.
Have you walked to the toilet while you've been here?
Alpha 2, equal 1, Alpha 2.
And how are you on your...
If you're thinking of touching me, you better think again, mate,
Do you want me to
because you'll get covered in piss. You come near me. I've got a bottle of piss next to me and it's going to go all over you if you come anywhere near me. Do you understand that? I'm ready, it's full up and you're going to get covered in it. Anyone who touches me will get covered in my piss. So you come on, oh, you bring it on, mate. Bring it, no.
Can you stop filming?
No. What are you going to do about it?
Can you just stop filming?
No.
Yeah.
What are you going to do about it? Hmm? You're going to commit offence? You're going to assault me, are you? Give it one try, mate. You're going to be covered in piss. Everyone will.
Stop filming.
No.
I'm not sure.
Call the police.
Yep, please.
Good. Good.
Okay.
Outside.
Okay. What I'm going to do is I'm going to get a stick for you to use while you're here.
Say that?
I'm going to get a stick for you to use while you're here.
Filming. He's not.
I don't mind, but I hope I'm not here long enough.
No. It's just for you. Would that be useful? Yeah? Okay.
He's filming while he's being fucked, mate.
This camcorder is filming.
Filming or fucking, did he say?
To stop, he's in the hospital, probably he won't listen over.
Because you've got no authority over me, mate, that's why.
Has he had all his documentation done?
No. I've still got an IV in my arm, look. So I think you've been misinformed, mate. I think you've been misinformed.
But he still does have a kind of
Twat.
Okay. Well,
Right, I just want to point out the medication they... Come on, let's have it, mate, let's go. Bye. Bye. I'm going to wave goodbye then. Bye everybody. Hope I never set eyes on any of you again. Well, until we get to court, that is. Yes, absolutely. What are you going to do about it? You going to stop me? Throw me out? Get back to civilization. We're some real human beings. Just Fraser. See you, Fraser.
Take care, Charlie.
Be lucky, yeah? Ta-ra, mate. Ta-ra.